Honorable Joseph Naisinga, Chairperson of the African Committee of Experts on the Rights and Welfare of the Child, distinguished members of the African Committee of Experts on the Rights and Welfare of the Child, distinguished participants, dear colleagues, ladies and gentlemen. Allow me at the outset to express my gratitude and thanks to the African Committee of Experts on the Rights and Welfare of the Child and its Secretariat for convening a workshop on popularization of Africa's Agenda for Children 2040 and the report of the study on mapping children on the move in Africa in Asmara, Eritrea in 2019. I take great honor in addressing this August committee on behalf of my government and the high-level delegation present, a statement in relation to the response to the comments and the observations forwarded by the committee against the second and third periodic report of the state of Eritrea on the implementation of the African Charter on the Rights and the Welfare of the Child. The socio-economic context of Eritrea, like many African countries, has been subsistence agriculture, which includes more than 70% of the population who live in agrarian settings, and the nascent industrial and manufacturing sector, which have been hampered due to the continuous aggression and sanctions to relinquish the sovereignty of Eritrea. Yet, Eritrea, in spite of all odds, has relative success in moving forward, such as ensuring the basic minimum necessities of the people, curtailing the recurring drought and the prevention of COVID-19, mainly by having selfless and committed leadership, using a community-based approach, empowering the people to be the masters of their destiny, efficient use of resources, focusing on the most needy, strengthening resilience and building partnership. It is in this context that the national report on the implementation of this report should be seen, and some of the milestones are the strong commitment and the political will of the government, who have been crucial to the implementation of the Charter. Eritrea's commitment to children's rights has been well documented during the critical time of liberation war, which emanates from its vision of social justice, which is incorporated in various legal instruments and policy documents. Eritrea adheres to the major international conventions, including the African Charter for the Right and the Welfare of the Child, the CRC. The venue for the national service training is in the same vicinity, as Eritrea cannot afford to astray its limited resource. Universal education is the motto, yet due to the vast history of colonization, the continuous war that had been unleashed upon Eritrea, and also due to the rudimentary mainstay of our people, there still remains a large segment of our children out of school. The government of state of Eritrea has been earnestly working to alleviate this problem by establishing schools for those that have not had this opportunity in the nomadic and remote villages. Besides establishing boarding schools, in the venue of education also, it prepares school feeding program and has been introduced to encourage families to send to school their children. This is bearing fruit, and more than 20,000 of those children out of school have already enrolled. Honorable Chairperson, all actions concerning children, whether undertaken by public or private social welfare institutions, courts of law, administrative authorities, or legislative bodies, the best interest of the child has been given due consideration. The government of state of Eritrea intervention on the upbringing of the child starts before he or she is born. Making safe maternity is one of the major policies, and assuring the basic vaccination of the child, which currently is more than 90%, even during this critical period of COVID, is manifestation of the rightness of the government of Eritrea's policy. The government is consolidating its strength of achievement, especially the 3 MDs related to child mortality, maternal health, and HIV/AIDS. Civil and vital restoration is of utmost interest, and the government is working via the Ministry of Local Government, has been conducting training local community leaders to fulfill their tasks, and earnestly working to achieve universal registration. The Ministry of Health will also register a child born at all health centers and ensures that traditional birth attendants are trained with the basic skill support pregnant mothers to give birth and register the newly born baby. Yet, the medium of reporting and developing data system that captures the required information needs to be strengthened. Children with disability, need of education, health, and other needs, with the available resource is catered with utmost care, and the intervention of Association of the Disabled has played a crucial role in the awareness raising of the people, in demystifying the myth and negative cultural taboos that takes the children with a disability as a curse. Honorable Chairperson and members of the committee, Eritrea has been working to take all measures possible to ensure that not only do children survive, but are also developed to achieve their full potential. Children at minimum level of education are enlightened and do participate in summer work program in their vicinity, which is instilled at a young age to appreciate and share in restoring land degradation and combating desertification when they are grown up. Eritrea is on track to its policy of zero tolerance to the harmful practices like FGM and underage marriage. The Minister of Labor and Social Welfare, Minister of Health, the National Union of Eritrean Women, and with partners together have established an institutional mechanism to curb it completely within the time frame agreed upon internationally by 2030. Using the bottom-up approach, whereby communities are openly having public declaration to disavow this deep-rooted culture is an uplift. Since children's affairs is closely related with the National Union of Eritrean Women, a strong working relation exists. Besides, the policy of children have been developed in 2016 and serves as a guide to all sectors to follow the mechanism of monitoring. The government of State of Eritrea has stepped up its cooperation in this respect by signing the United Nations and Government Sustainable Development Cooperation Framework 2022 to 2026 to fulfill the SDG goals and to achieve Africa Fit for Children. Honorable Chairperson, the African Charter for the Welfare and Rights of Children is a plus to the CRC, as it adds up areas pertinent to Africa, since it addresses the same critical issues of the child's right. If I may request your esteemed attention to find a way of having one body that can reinforce and lead the state parties in a comprehensive and pragmatic way to create synergy and save the limited resource that we have. Besides, Eritrea respectfully do want to clarify time and again that those who have vested interest to destabilize the people and the government of Eritrea do continue to demonize the country using the service of the so-called human rights organization, which are maliciously slandering its people in the government. Honorable Chairperson, members of the delegation. In conclusion, on behalf of the government of the State of Eritrea, let me assure you again that Eritrea's commitment to promote sustainable development will uphold the Eritrean children's rights and welfare to its fullest attainable level. On this occasion, I salute the achievements made towards the right and the welfare of children in our continent and renew our solidarity and commitment to the goals we chart together. I wish you all a fruitful, constructive dialogue and conversation that would contribute to the best interest of our children. I thank you. and the commitment to the goals we chart together. I wish you all a fruitful, constructive dialogue and conversation that would contribute to the best interest of our children. I thank you.
Nous vous remercions. Nous vous remercions, Excellence, Madame le ministre du Travail et des Affaires sociales pour cette présentation, mais également, comme je l'avais bien mentionné au départ, pour cette disponibilité. Mais également, nous apprécions les efforts déjà fournis dans le cadre du respect des obligations contenues dans la charte, mais aussi, comme vous venez de le dire, à la conclusion de cet engagement du gouvernement de l'Érythrée afin que les enfants puissent continuer à jouir des droits garantis par la charte. À présent, nous allons procéder aux échanges et nous allons commencer par le premier groupement thématique en rapport avec d'abord les mesures générales de mise en œuvre quant aux obligations des États parties, mais également à la définition de l'enfant. Aussi, nous allons parler des principes généraux comme la non-discrimination, l'intérêt supérieur de l'enfant, la survie au développement, la liberté d'expression, loisirs, activités récréatives et culturelles, comme aussi la non-discrimination. Et également, dans un dernier aspect des droits civils et politiques, les droits civils et libertés. Et là, c'est notamment le nom et la nationalité, comme également d'autres aspects. Nous avons, dans un premier temps, le rapporteur pays, qui est en même temps le vice-président de notre comité, l'honorable Anne Moussiwa, qui sera secondé par l'honorable Karuna. Et après, on pourra donner la parole aux autres membres du comité. Et généralement, nous accordons une petite pause, mais pas une pause communautaire. C'est un moment de concertation entre la délégation et pour pouvoir fournir des éléments de réponse, de clarification par rapport aux préoccupations émises par les membres du comité.
Thank you very much, Mr. President, and good morning to you and morning to all the other honorable members of the committee. Allow me also to just iterate to what the President has already said in terms of welcoming the delegation of Eritrea. We thank you, Your Excellency, for affording yourself the time to come and present the Eritrean report to the committee. As the chairperson has already highlighted, this is a dialogue. We are not here to interrogate. We are not a court of law, but a dialogue to understand the well-being of the children of Eritrea vis-a-vis the realization of their rights and possibly come up with recommendation to assist the state of Eritrea in improving around the areas of children's rights. Without wasting much time, the President has already highlighted the clusters which we are going to start on, the 4 clusters. So I'll just go straight into my questions. May the delegation apprise the committee on what the government of Eritrea is intending to put in place in terms of policies laws, and strategies to ensure that the constitutional rights of Eritrean children are implemented. From the report, it depicts that activities for the promotion of child rights are within different line ministries. Is the government of Eritrea intending to establish specific institutions for coordination of state child governance issues? If so, will there be a coordinating department? Is there a centralized database which is user-friendly in terms of disaggregation for easier access and also analysis for a better understanding of the well-being of Eritrean children? The committee knows that Eritrean's laws refer to children as minor persons, and that the child is defined in accordance to the values of specific groups. May the delegation apprise the committee on the government's plans or intentions in relation to harmonization of laws in the best interest of the child. What measures has the state put in place to ensure that children of certain religious groups, including those children infected with HIV, are not discriminated from accessing health services and education? In relation to this, does Eritrea have an act for children specifically focusing on children's issues? It is believed that a number of children in Eritrea are migrating to other countries. May the delegation enlighten the committee on how the state is ensuring that such children will not find themselves in Sawa military camp. How are these children protected from the shoot to kill policy if they are found? Eritrea's constitution guarantees the right to nationality. May the delegation apprise the committee on the birth registration rate of Eritrea from 2014. Has birth registration been increasing over the years since 2014 or not? Is the state facing any challenges in capturing such critical data? For now, thank you. I'll hand over to my co-rapporteur, Honorable Karuna.
We shall start to reply. First of all, thank you very much for all members of the committee for forwarding the questions. And as has been stated by the president, this is a constructive dialogue. So let me start on the question that was raised. Was civil society organizations and children participated? Yes, the civil society organizations like the National Union of Eritrean Women, the National Union of Eritrean Students, the National Confederation of Eritrean Workers, the 4 associations for persons with disability participated in compiling the reports. That's why some of the statements and data that's included in the report is also included. With regard to child participation, the report indicated that there are committees established in ensuring women and child rights, and therefore in every sub-region, we call it sub-zona in our local language, 2 students, a girl and a boy, are involved in these committees. The allocation is geographical, but not only in these committees, even in the civil society organizations like the National Union of Eritrean Women, the National Union of Eritrean Youth and Students, children also participate. In occasions like the girls, children, and the Africa and the International Children's Day, children also participate. So that's what I can try to brief with regard to the civil society and children's participation. With regard to birth registration, yes, there has been an increase. I may not right away be able to substantiate it with data, but an increase as the awareness is increasing, so is the birth registration, as has been indicated in the report. Even in the opening statement of Her Excellency the Minister, birth registration is there, but also the Ministry of Health does register any newborn child in the clinics that are very close to the grassroots as well. So that's there as a law, as has been specified in our report, and the practice is going on. The Ministry of Local Government is the responsible agency because it has its structure extend to the administrative environment. So we are working on it too. With regard to resource limitation that was quoted, it's meaning to say that we've been doing activities related to children, be it on education, be it on health, be it on child and social protection. That's because we had the resources either from the government or from partners. So it's meaning to say that because of resources, we could not implement the African Charter on the welfare of the child. Otherwise, of course, time and resources are required to implement the whole articles specified or enshrined in the African Charter on rights and welfare of the child. Having said, with regard to migration, I will just make mention of it, but maybe other colleagues will also give some supplements. At the first place, the migration, the trafficking in this part of the world, even in our sub-region, is not made in the countries that we are talking about, like, for example, Eritrea. I hope the committee understands that the issue of illegal migration, the trafficking, is not only regional but global. It's concocted even in the northern hemisphere. They also have their satellites in the region. And therefore, as we try to explain in our report, even the president of the state of Eritrea tried to notify to the Secretary General that Eritrea would like to be engaged in such kind of undertaking globally. What is the cause? Why is the trafficking continuing? It has become sort of a business for some international and regional organizations. And I'm sorry to repeat, it's been mentioned even in our report that even very well-known presidents, like the President Obama once mentioned that women and children from Eritrea are most welcome. And therefore, this kind of invitations and the attitude of illegal migration, of trafficking has been encouraged to, in the name of Eritreans, in the name of Eritrean children, in the name of Eritrean women. There have been governments that have been invited. But this does not mean that we have a role to play to minimize what's happening. Here locally, we are trying to sensitize our population, particularly regions that may be affected by trafficking, which are very close to the borders of our neighboring countries. At the same time, we've been assisting some families through the social protection program. We've been introducing since the last 3 years new salary increments for graduates of certificates and first degree, second degree, etc., so that their livelihoods can be improved and they can be hired. They can be hired too. So we're trying as much as possible also in the region.
So, okay. So the MOE or the Minister of Education's policy is inclusive education. When we say inclusive education, it includes all children despite of all the language, gender, sex, geographical area, disabilities, and so on. So on one hand, we say it's inclusive education, so we try to make it inclusive. On the other hand, we have these children with disabilities. So you asked what measures do we take or how we apply, what are the measures taken for these children with disabilities? For example, we have 3 special schools, one for the deaf and for the blind. These 3 special schools, they are not enough, they are not adequate, but the Ministry of Education now has a plan to increase these special schools. And we have also about 25 special classes, annexed classes with the elementary school. These 25 special classes, they are for children with autism and Down syndrome. So until they finish the elementary, they get special treatment, special classes. But then all these special classes, they have to be mainstreamed within the education system. And while we are mainstream those students who were benefited from the special needs, then we need, there are some challenges to support them inclusively. So the Minister of Education or the government is working very hard with some developmental partners. So there are some problems or challenges with infrastructure or to give them a full and adequate support, but the ministry is aware and working for it.
So let me wrap up. FGM has been on the agenda of Eritrean people, I can say, since 1980, during the armed struggle. Under Eritrean People's Front, the National Union of Eritrean Women was established at that time. And one of its key responsibility was to tackle FGM, the existence of FGM, by strictly dwelling on awareness raising activity among our community, because this was a sensitive traditional issue. We cannot jump and take any radical measures, but to create awareness among our people. So it was a very vast program that was undertaken. After independence, 1995, together with the Ministry of Health, the DHS program was undertaken to see the prevalence. And we found out that 95% was the prevalence, 95% was the prevalence rate of FGM in Eritrea. It's huge, it's huge. It means we have done nothing, like it's only 5% that we could trace with these campaigns that we have been doing. The question was raised like, what lessons could we learn or could we share with each other in tackling FGM? Was, I think, the main question raised. So number one, what we did was awareness was not enough because we have seen the prevalence rate very high. So a thought was given that we should have consider the law, or if we should prohibit by law FGM. So since 2005, 2006, we tried to establish, the government established it under the auspices of the National Union, Minister of Health, Minister of Justice, a committee to establish a proclamation or to develop a draft proclamation. And this draft proclamation was then proclaimed in 2007. It's number
158 of 2007. It was a very important proclamation, and we took a strict measure to implement it. Since it came as a law, since FGM was now both with awareness raising activity program and at the same time by law, the law was taking a very good ground because in Article 4 of the proclamation we have the penalty, the punishments are imprisonment and fine, and mostly in most cases the practitioners were the female TBAs or traditional birth attendants, women who were involved in helping delivery of the child, especially in the villages and remote areas. So the prime focus was to aware this group at the same time to apply the law. And as our data of 2013-2017 indicates, since the proclamation was proclaimed, 250 cases related to the breach of this proclamation were forwarded to the court, of which 163 cases were decided and 67 cases are still pending. So by taking these strict measures due by law, we have tried to minimize the practice of FGM. But the law alone is not enough. So the public awareness is ever going. So one of the lessons that we should share with you is what we did in raising the public awareness. Number one was the involvement of high-level religious leaders. The Archbishop from the Christian side and the Mufti from the Muslim religion, they were involved, and they were, came to the national TV and they told every people, every believer that this has nothing to do with religion. This is a practice, a traditional practice, but has nothing to do with religion, because people were thinking this is a religious stuff. So they were afraid, to stop it totally. So we have to create this kind of belief by involving our religious leaders, but not at lower level, but at high level, the Archbishop and the Mufti. So this worked very good. And then we tried to establish community-based anti-FGM and anti-underage marriage committees. And this were, we have Eritrea, we have 6 regions, and every region or Zoba has a governor. So these committees were chaired by the governor of that particular region, meaning we gave the whole responsibility to the governor with all its structure. So this also worked. So we have over 750 at a time, 750 committees in a region where everybody was, part of it. Later, at 2017, we came up of establishing a steering committee at a national level. But now it's not only the National Union or the Minister of Health, but we have involved Minister of Labor and Human Welfare, Minister of Information, and Minister of Health, plus the National Union of Eritrea Movement. Presiding, the chairpersonship is always rotating. So this these huge ministries, key stakeholders on this issue are working together, and partly, in most cases, it's the awareness raising of our people. So we have the law and we have the awareness raising programs going in tandem. Finally, we have now, as a result of these efforts, we have 2 sub-Zoba in the remote areas, by the way, in the remote areas, Haboro and Asmat, they have declared 0 FGM. 4, they have declared 0. The current prevalence rate, as we have the data here, is in 2010, it was 6.9 for under 5. And for under 15, it was 18.2. Currently, in 2018, this was done by a mapping of 135 villages in 2004. So we have 6.9 for under 5 and 18.2 for under 15. Now, in 2018 and 2020, we have reached a very good stage, we can say, which is for under 5, it is 0.54. For under 15, it's 2.3. So we're riding on the right track, but this shall not mean that we don't still have challenges. We still have challenges, and the challenge is on the awareness, on the level of awareness of our communities. So we are working very hard, and we are really satisfied by the results we are getting. Thank you.
Thank you, Mr. Maratab, and thank you for the committee for their comments and concerns for clarification. I think issues related to FGM and underage marriage has been thoroughly addressed by my colleagues from the National Union of Eritrean Women. And actually, the best practice related to FGM and underage marriage is the establishment of high-level committee, both at national as well as at regional and sub-regional levels. It has been also indicated by Mr. Mehratab that these committees, especially at the lower level, includes children who are under 18 years, both from both sexes, I mean male and female. So basically, based on the different mapping exercises that have been done, it has been explained by Mr. Knight that prevalence of FGMC has been reduced in under 5 and also under 15 years of age. This is actually as a result of the concerted efforts made by the different actors at this ZOA and sub-ZOA level. This prevalences decrease may not be interpreted for at national level, but this mapping is done at certain places, but actually we'll see what the status of FGMC and underage marriage is when the Eritrean Demographic and Health Survey will be done soon in this year. I think there have not been any health-related questions except for COVID. The COVID issue, probably when the pandemic was raising, when it was started in Wuhan city of China, Eritrea has been vigilant on the issue, and it has been aware that it has a risk of the spread of the disease to travelers, and measures that should prevent the disease have been taken care by establishing a national task force who guides the prevention of the disease. And this task force has been extended to the regions and sub-regions. And also these were supported by technical people, both at national and regional levels. So basically, the government has put lots of funds on catering or in preventing the disease, and also treating the cases, as well as quarantining the suspected cases of COVID-19. You might have seen it in the report that COVID-19 has been a blessing in disguise. It has been an opportunity for the Ministry of Health to strengthen its health systems, because it was really a honeymoon for the Ministry of Health to have quite a lot of investments in the health system to actually respond to shocks that could be arising from the different emergencies. As indicated in the report, in 2020, about 40 million of US dollars has been incurred, as well as also in 2021, about 42 million US dollars have been incurred in strengthening the health systems. All this has been incurred, these expenditures have been incurred or budgeted by the ministry, by the government of the state of Eritrea. I actually could say that we had wonderful prevention programs with different strategies that have been stated in the report. And also we actually feel that although we have deaths reported due to COVID-19, I think the program went well.
When it comes to human rights, and especially on issues related to Eritrea, there is the image and perception created by NGOs who have nothing to do with us, as well as the media, which is manipulated and controlled by big powers who are not friendly to us. So what we'd like to advise and encourage the committee to do is to understand the reality in Eritrea, not only through the reports that we present, but also checking the reality on the ground, to come, visit, and see. And Eritrea is open to learn from the experience of others. It's open to admit its mistakes, and also to ameliorate the situation, because we are talking about the situation of children that are our present and future. What I was trying to say was that we are ready to learn from the experience of others, to correct our whatever shortcomings there are. And also for that, we are willing and ready to engage with the committee for it to assess things on the ground by itself. Some of the labels and catchphrases which are imposed on Eritrea are not based on fact. These are the working of some of the NGOs and media who have a negative attitude towards Eritrea. So what we would like to do is for the ACRWC, which is our body, which is our committee, to engage directly with us and to tell us whatever shortcomings there are, and we'd be happy to engage positively. And finally, I would like to thank the members of the committee and my colleagues in the delegation for the very positive engagement. Thank you.
Merci beaucoup, Monsieur Biliam, chargé d'affaires, pour ces propos. Et encore une fois de plus, nous remercions la délégation, nous remercions son Excellence, Madame le ministre du Travail et des Affaires sociales. Et également, je voudrais remercier tous les membres du comité, plus particulièrement le rapporteur pays, le vice-président du comité, honorable Anne Moussiwa, également l'honorable Karuna, et remercier toute l'équipe de notre secrétariat, remercier les interprètes et remercier tous les distingués invités qui nous suivaient en ligne. Et nous mettons fin à cette séance. Et encore une fois, merci et bonne continuation.